Dr. Taylor Nichols is this year's recipient of the Policy Pioneer Award. Dr. Nichols was nominated for the Policy Pioneer Award in recognition of his fearless advocacy, media leadership, and commitment to combating medical misinformation. A member of his chapter's board of directors and a former FACEP advocacy fellow, Dr. Nichols became a nationally recognized voice during the COVID-19 pandemic. His candid and powerful account of treating a patient with a swastika tattoo as a Jewish physician sparked national conversation and was featured in major outlets including the Washington Post, San Francisco Chronicle, Sacramento Bee, and CNN. Dr. Nichols has emerged as a prominent advocate in the fight against physician-led misinformation. He currently serves as board member and chief development officer for No License for Disinformation, a nonprofit organization dedicated to holding physicians accountable for spreading harmful falsehoods. His work has been highlighted in the Atlanta Journal-Constitution, Washington Post, and numerous regional news broadcasts. Beyond media advocacy, Dr. Nichols is a frequent lecturer on the role of emergency physicians in health policy. Whether teaching at residency programs or speaking at FACEP's Leadership and Advocacy Conference, he empowers future leaders to engage with policy and raise their voices for evidence-based care and patient safety. Dr. Nichols embodies the pioneering spirit this award celebrates, using his platform to shape policy, influence public discourse, and advocate for truth in medicine. FACEP is proud to award this year's Policy Pioneer Award to Dr. Taylor Nichols.
What a tremendous honor to be selected for the Policy Pioneer Award and stand on the shoulders of giants. Seeing the names of those who have received this award in the past and knowing their work in advocacy, public health, and health systems research, I feel incredibly undeserving. Every day in our emergency departments, we see the stark reality of healthcare inequity. We see patients who cycle through our doors not because we failed them medically, but because our system failed them fundamentally. That recognition drove me to pursue health policy and advocacy as part of my career. We're on a precipice now, and our emergency departments are the canaries in the coal mine of the healthcare system in collapse. We see the boarding, the long wait times, the lack of access to care. Science and healthcare are under attack. With impending massive funding cuts across the system, our profession is under greater threat now than ever before. We have already been struggling through challenging times and under increasing pressures, and we're suffering as a result, both as a specialty and as individuals. But we are the Swiss Army knives of healthcare. We adapt, we MacGyver our way to solutions to keep patients safe and to save lives. We are the problem solvers, which is why we are particularly well suited to take on this challenge. Now that problem solving needs to reach beyond just the walls of the emergency department to the political determinants of health, pushing for change within our institutions, our state capitals, and in Congress. Through my health policy and advocacy work, the two most important things that I've learned are the most simple. Every policy that we shape today determines the resources that we'll have tomorrow, patients' lives that we can save, and the communities that we can impact, and that our voices matter most. They are the currency of advocacy. So to my fellow emergency physicians, while your clinical expertise is powerful, your voice in policy is transformational. The patients who trust us are sharing their burden and deserve advocates who will fight for them in every arena, not just in our resuscitation bays, but in our state houses and beyond. This award is more than just a recognition to me, it's a call to action. The most important solutions to the crises that face emergency medicine today are systems-level changes. Shaping policies to create a more just and equitable health care system, bolstering important science funding and social programs, and in turn, creating healthier and more vibrant communities that we can serve. Patients are suffering, our colleagues are suffering, our healthcare system is suffering, and we need to rise to meet this moment. I know that we can, I know that we will, and I'm grateful to FACEP for this honor and for trusting me to carry this work forward. Thank you.